Welcome, everyone, to Newly Diagnosed Next Steps. My name is Mary Ellen Rogers, and I'm a certified patient navigator with the Breast Cancer Resource Center, BCRC, a community health worker, and an 8-year breast cancer survivor. When you first receive a breast cancer diagnosis, your life is turned upside down. The goal of this class is to provide you with information that answers a majority of the questions that you may have when you are first diagnosed. We will discuss breast cancer basics, answer common questions about your diagnosis and treatment, take you through the many steps, procedures, and terms that you need to know when you are newly diagnosed with breast cancer, go over your healthcare team members and their roles, discuss practical tips, and provide resources. We will define patient navigation, and finally give you information about BCRC and how we might be able to help you as you move through your diagnosis, treatment, and after treatment ends. It takes time to develop a diagnosis and treatment plan. Once you have a biopsy, the pathology report will be forwarded to a surgeon and/or a medical oncologist. There'll be many appointments, phone calls, testing to be completed before your treatment can begin. The surgeon and/or medical oncologist may have you scheduled for a CT scan, a breast MRI, additional blood work, a visit with a genetic counselor for genetic testing, and possibly more. The questions you see here will be answered at some point by your surgeon and/or medical oncologist. And it's inevitable that you will continue to think of more questions as you go through the diagnosis process, and know that that's completely normal. Your pathology report has a lot of information about your breast cancer, and it can be very overwhelming to sift through. The details we discuss here are not inclusive of what you will find in your report, but they are all important in classifying your cancer. There are many sections of the report that give you different information about your diagnosis, including different descriptions of your biopsy sample and your final diagnosis. We won't go over each section, but this guide, produced by breastcancer.org, has great explanations of each section. You can also access the information on their website. Special tests markers section summarizes the most important characteristics of the cancer. This part may be longer or shorter, mainly depending on the style of the pathologist. The final diagnosis usually describes the type of cancer, and it will likely include some of the markers that you see on this slide. Well, I'm not authorized to go over specific parts of your pathology report. Know that once you go over that report with your team, we recommend that you speak with the oncology nurse or navigator who will be happy to clarify anything that might be confusing. There are many ways to describe the different types of breast cancer, and it's very easy to get confused over your diagnosis. The type of breast cancer is determined by the cells in the breast that are affected. Many times you'll hear a breast cancer diagnosis referred to as either in situ or invasive. In situ is a cancer that started in a milk duct or lobule and hasn't grown into another area of the breast. Invasive breast cancer describes any type of breast cancer that has spread to a surrounding area of breast tissue. The two most common types of invasive breast cancer are invasive ductal carcinoma and invasive lobular carcinoma. These differ in where the cancer starts forming, either in the milk ducts or lobules. And then there's inflammatory breast cancer. That is a less common type of invasive breast cancer, and it's characterized by swelling and reddening of the breast, instead of a lump that is more commonly seen in the other types. Many times breast cancer will be described by its stage. Staging is used by your medical team in order to understand your prognosis, guide treatment decisions, and provide a common way to describe the breast cancer so that treatment results can be easily compared and understood. Early stage cancer, stages 0 through 3, are classified by the size of the tumor and the number of lymph nodes anticipated to be positive for cancer. A medical oncologist may estimate the stage, but really won't know the actual stage until they receive the final surgical pathology report. The official tool doctors use to describe the stage is the TNM system. Doctors use the results from diagnostic tests, scans, and final pathology report to answer these questions. Tumor, T. How large is the primary tumor in the breast? What are its biomarkers? Node, N. Has the tumor spread to the lymph nodes? If so, where, what size, and how many? And then metastasis, M. Has the cancer spread to other parts of the body? The most important thing to remember is that no two patients will have the same treatment plan. Everyone is different, and each treatment plan depends upon the type of breast cancer. So as difficult as it is, try not to compare your treatment plan to someone else's because there are so many factors that contribute to your personal plan. Most patients have surgery to extract the cancer from the breast, can be before or after treatment. At the time of surgery, lymph nodes under the arm are usually removed and examined and tested to see if they contain cancer cells. Surgery is a local treatment, and since it treats a particular part of the body, there are two main types: breast conserving surgery, also known as a lumpectomy. That will remove the cancer, but not the breast itself. How much of the breast is removed will depend upon factors such as the size and location of the tumor. Mastectomy removes the breast, which means the majority of the breast tissue is removed, including additional nearby tissue. Sentinel lymph node biopsy refers to the removal of the sentinel lymph node during surgery. During a sentinel lymph node biopsy, a radioactive substance and/or blue dye is injected near the tumor. The sentinel nodes, the first lymph nodes to take up that material, are surgically removed and checked for cancer cells. Reconstructive surgery, that is surgery that is done to reshape or rebuild a part of the body that is changed by previous surgery. There are several types of reconstructive surgeries available. Deep flap surgery uses your own abdominal tissue that gets relocated to your chest. Implant-based reconstruction can be done with either silicone or saline implants. And then thirdly, aesthetic flat closure. It's another reconstruction option that involves precision to contour the chest wall and have very clean, symmetric incision closures. Chemotherapy. Pharmaceutical drugs taken orally or injected into a vein, muscle, or port are used to stop the growth of cancer cells, either by destroying the cells or stopping them from dividing. This is a systemic approach because it treats the entire body. Targeted therapy. In targeted therapy, drugs or other substances are used to identify and destroy specific cancer cells without harming normal cells. Radiation therapy. If radiation therapy is prescribed, it can be administered externally or internally. During external radiation therapy, a machine located outside the body sends high energy radiation or other types of radiation toward the cancer cells to destroy them or keep them from growing. Internal radiation therapy involves the placement of a radioactive substance, usually sealed in needles, seeds, wires, or catheters, and it will be inserted at or near the cancer site. This is a targeted approach and treats a specific part of the body. Hormone therapy, also known as endocrine therapy, is given orally. It slows or stops the growth of hormone-sensitive tumors by blocking the body's ability to produce hormones or by interfering with the effects of hormones on breast cancer cells. Beware of Dr. Google. There is so much information about breast cancer on the internet, a lot of which does not come from credible sources. So it's important that when you do have questions or you're looking for information about your diagnosis, that you go to credible sources that are backed by science and research. Some of the sources that we recommend are listed on this slide. One topic that may not get brought up when you're first diagnosed is your fertility. However, if having biological children after your cancer treatment is something that you want to consider, it's recommended that you have a conversation with your oncologist before beginning treatment. Many of the treatment options your oncologist will recommend can affect your fertility. Your oncologist can refer you to a fertility specialist who will go over your options before your treatment begins. And this slide lists some of the questions that you may want to ask regarding your fertility. It is recommended that you see the fertility specialist to discuss the costs involved. There is some financial assistance available. Visit the BCRC website for the list of possible financial resources. Additionally, the SAM Fund Family Building Grant is a helpful resource for anyone between the ages of 21 and 39 who wishes to move forward with fertility treatment options following the conclusion of cancer treatment. Palliative care is medical care that focuses on relieving symptoms and side effects from your treatment. People who receive palliative care along with treatment for the cancer often have less severe symptoms, better quality of life, and are more satisfied with their treatment. You may have palliative care at any age and for any type and stage of cancer. Because palliative care has so many benefits, we recommend you begin seeing a palliative care doctor early in your diagnosis and treatment. Palliative care is often compared to hospice, but these are two types of care that are very different. They serve two very different purposes. Your healthcare team is made up of so many different medical professionals, and each plays an important role, which I'll go over shortly. But it's important to know that this team is fluid. And just because you, say, have been referred to one specific oncologist, for example, it doesn't mean that you need to stay with that doctor for your entire treatment plan. Decide whether you want second opinions after your initial consultations, but check with your insurance to see how many that they will allow. Know that you have the right to seek other doctors if you feel it's not a good fit, and change. You must be your own self-advocate, and there'll be so many decisions that you will need to make. Your medical team consists of healthcare professionals whose job it is to make sure that you are informed and prepared for your treatment. Remember, you can and should ask questions and become an active member of your team. Physicians work together to follow your case and discuss your treatment, and your medical experts include a medical oncologist. They manage your overall cancer care, including identifying appropriate systemic treatments, as well as clinical trials if necessary. Surgeon plans the surgery and removes the breast tumor. Plastic surgeon performs breast reconstruction after breast surgery. Your primary care doctor attends to your general healthcare needs. Radiation oncologist treats cancer by transmitting high energy radiation to shrink and kill cancer cells. Don't forget your dentist, best to see prior to starting any chemo. A palliative care physician helps to manage potential symptoms from different medications. Oncology nurse coordinates with your medical oncologist. A nurse navigator is often affiliated with a hospital or oncology practice. The nurse navigator coordinates your clinical needs and can answer questions about the clinical aspects of diagnosis and treatment. Your nurse navigator might also coordinate your care with your medical oncologist. Patient navigator train professionals who work closely with the clinical team by offering guidance, education, and assistance, and access to community resources that are appropriate for your needs. Social worker and financial counselor will provide counseling on financial or family concerns during your treatment. A nutritionist can help you with diet to help manage your side effects. Physical therapist, they might be needed after a surgery to help you with range of motion. And lastly, a mental health specialist or a therapist. They can help you work through any emotions or difficulties you might be going through. A recent breast cancer diagnosis is both scary and confusing, among many other things. So tonight I'll go over the top priorities for you and how to navigate those priorities. One of the first things you should do, if you haven't already, is look into your insurance. If you are insured, find out what your policy covers. And if you have questions, a patient navigator or financial counselor may be able to help. If you're uninsured, ask a patient navigator or financial counselor about what programs that you may qualify for. Triage Cancer is another really good resource with information not only about health insurance, but on many legal and financial aspects of a cancer diagnosis. Every employer has different policies for taking extended time off, and there are many different types of leave. So if you are working, we would recommend reaching out to your HR representative to learn more about your specific time off policies. Cancer and Careers is another great resource that empowers and educates anyone with cancer. They have experts who can share advice as well as interactive tools and educational events. One reason receiving your cancer diagnosis is so overwhelming is because there's so much to keep track of. One thing that seems to be helpful for a lot of our clients is keeping a binder to organize things such as your medical appointments, questions to ask each doctor, your medical records, copy of reports, medical bills, prescriptions, etc. Some of our clients also enlist the help of a family member or friend to help them keep track of all the paperwork. Many also use a spreadsheet to track their lab tests and scan results from each visit. Chances are, once you start sharing your diagnosis with your friends and family, there are going to be so many people who want to help, but they might not know how to help. Having a list prepared of things that you need help with will be important when someone comes to you and asks, "What can I do to help?" Some things you might consider having people help you with could include childcare or play dates, transportation to your treatment, medical appointments, surgery, help with cleaning the house, bring over meals, lawn care, walk the dog, grocery shopping, pick up your prescriptions. So there's some great resources that your friends and family can use to help coordinate or help keep everyone updated. Caring Bridge is a website that you can use to create a page where you can share any updates with your friends and family. We know it can be very overwhelming to have to constantly give your loved ones the same update individually. So Caring Bridge is very helpful so that you just give everyone the link to your page and then they can read it whenever you make an update. Cleaning for a Reason, if you are in their service area, offers 2 free house cleanings. Meal Train is a great way for your support system to organize meal deliveries to you as you're going through treatment or surgery recovery. Care Calendar is another website that combines everything from meals, transportation needs, updates, and gifts. A friend or family member can keep the calendar updated for you. Lots of Helping Hands is similar to Care Calendar and helps to coordinate meals and extra support. And then Amazon Wishlist, that's a great tool you can use if there's certain items that you need and people can purchase them for you. It's not always easy to ask for help, but having that support from your friends and family during this time in your life can be so helpful. Here are some tips that you can share with your loved ones when they ask, "How can I help?" Listen. One of the easiest ways a loved one can help is to just listen. A lot of times you might just want someone to talk to without them being a cheerleader. Support treatment decisions. If you feel comfortable, you can invite your loved ones to share decision-making with you, but just remember that every treatment decision is ultimately your choice. Giving them specific things they can help you with. The list on the previous slide provides a lot of concrete things your loved ones can help you with. As we said, it can be frustrating when someone says, "Call me if you need anything." So having that list ready will make it a little easier when someone offers their help. Staying connected, especially after treatment ends. If you choose to make a personal webpage to update family and friends on your treatment, try to keep it updated even after your treatment ends to make sure that you still receive that much needed support after treatment. And then keeping things normal. Your cancer diagnosis can be very isolating. And a lot of times loved ones try to help by taking over everything and leaving nothing for you to do. So keeping a somewhat normal schedule helps many when going through treatment. For instance, say you enjoy cooking and you feel up to it, tell your friends and family you would rather cook dinner instead of having them make it for you. Slow down and take a breath. This is time to focus on you. Make yourself a priority. Treat your breast cancer like it is a full-time job and allow other people to care for you. Some ideas for relaxing could include meditation, gentle exercise like Pilates or yoga. Be sure to do one thing every day that brings you joy. Acupuncture can sometimes be helpful to help manage side effects. An oncology massage. Attend support groups and participate in Facebook groups. A patient navigator should be able to help you with information on where to find these specific resources. Patient navigation helps patients get the care and other resources that they need when experiencing a long-term or chronic illness. A patient navigator works with patients, their families, and their caregivers to overcome barriers to cancer care and support patients after cancer treatment. We recommend you connect with a patient navigator as soon as you're diagnosed. A patient navigator who's not a nurse is sometimes called a lay navigator because they are not part of the medical team. Patient navigators may be certified and may also be certified community health workers. While the patient navigator will be able to answer many of your questions, remember they are not medical professionals and cannot answer all of them. It's very important to build a relationship with your medical team so that you feel comfortable asking those questions that your navigator isn't able to answer. Nurse navigators are usually part of your hospital team. They're excellent in helping the patient feel comfortable in the hospital system. They can answer medical questions and more, as listed on the slide. In many instances, patient navigators and nurse navigators work very closely to ensure all the patient's needs are met. If you don't know if there are patient navigators in your area, we recommend that you connect to a social worker either at the hospital or at your oncology practice. Some of you may live where there are no navigation services or support programs in your area. So here are a few national organizations that offer online support and programs. Make sure to also visit the Breast Cancer Resource Center blogs and video resource library. We have recruited subject matter experts to provide trusted information regarding medical, emotional, practical, and lifestyle concerns in both our blogs and our video resource library. Our video resource library has informational content videos in both Spanish and English. So, who is BCRC? In the next few slides, I will discuss BCRC services for those living in the Central Texas area. If you're not in the Central Texas area, we hope you will reach out to navigation services in your area. Our mission at the BCRC is to empower those affected by breast cancer with personalized support and compassion. We're here to help clients replace fear, anxiety, and doubt with information, options, and hope. Our trained, certified patient navigators, all breast cancer survivors, are easy to talk to, and we understand the process. If you'd like to become a client, you will go through our intake and will be matched with a patient navigator who will be there for you to provide guidance and information every step of the way. Apart from patient navigation, at BCRC, we offer many services to our clients, including outreach, education, patient advocacy, social support, and direct financial assistance when it's available. All of our services and programs are offered to our clients free of charge, regardless of income, ethnicity, education, sexual orientation, or social support. And we're thrilled that in 2019, we received a 5-year grant from the Centers for Disease Control and Prevention, the CDC, which allowed us to create this video. When a client first comes to BCRC after receiving a breast cancer diagnosis, they are paired with a trained and certified patient navigator. We currently have 5 patient navigators on staff. In addition to their extensive training and certification, all of our patient navigators are also breast cancer survivors. We've been where you are, and we understand what it's like to be newly diagnosed with that whirlwind of emotions, the appointments, and you're learning a new language. We know how daunting that can be. Know that we also offer navigation in Spanish. The one-on-one support our navigators give their clients is unparalleled due to their unique perspective and experience with breast cancer. Our patient navigators help clients with communication issues with care team and loved ones, medical system challenges, coping with emotions, financial concerns or questions, and recommendations and resources for treatment recovery items. Our patient navigators are here to answer your questions, empower you to make informed decisions about your diagnosis and treatment, and just be there for you when you need someone to talk to who gets it. Patient navigators refer their clients to our local and national partners when there is a need for additional trusted resources. BCRC offers several different educational opportunities for our clients. For those diagnosed with early stage breast cancer, we offer this presentation live, as well as this recording, and a recorded presentation for newly diagnosed metastatic next steps. Our clients can access current local and national resources through our website. These resources complement the navigation services that we provide and allow our clients to access additional resources that we don't specialize in providing. In addition to all of these resources, our patient navigators are constantly working one-on-one with their clients to educate them on certain aspects of their diagnosis, treatment, and navigating additional resources. Our navigators help clients understand certain medical terminology that may be confusing for them. Patient navigators also teach their clients effective communication skills so that they can advocate for themselves and participate in informed discussions with their providers and care team. In addition to the one-on-one guidance from patient navigators, we also offer a number of support groups and online forums for our clients. Clients can also utilize our online forums to connect with other BCRC clients and receive real-time support. We have specific support groups for our clients based on where they are in their diagnosis and treatment process. And additionally, we have groups for our metastatic and our young metastatic clients to support their specific needs. Finally, we also have several support groups for our Spanish-speaking clients, women of color, and our young clients under the age of 45. Our support groups and online forums give clients the opportunity to connect with each other on a more intimate level and ask any questions they might have. Clients find these resources very helpful and feel very supported by the other members in the groups. Support forums and support groups are facilitated and moderated by patient navigators to ensure a safe space and to help differentiate fact from fiction. BCRC currently provides services to those living in Central Texas. So if you haven't already, call BCRC or visit our website to become a client. We're here to walk through this with you and be your advocate.